Charting a new course, Dr. Victor Asare Bampoe's vision for Ghana's NHIA. In January 2025, Ghana's healthcare landscape witnessed a significant transition. Dr. Victor Asare Bampoe, a seasoned physician and public health expert, was appointed as the acting Chief Executive Officer of the National Health Insurance Authority, NHIA, by President John Dramani Mahama. With a rich background including roles as Deputy Minister of Health and positions within global health organizations like UNAIDS and the Global Fund, Dr. Bampoe brought a wealth of experience to the NHIA.
First of all, let me say it's a great privilege to be nominated for this position, and I'm grateful to His Excellency the President because it's a very important position for Ghana to achieve universal health coverage. What I do bring to the organization is that mix of working at the lowest levels, then working at the international level, and bringing that international experience also to bear.
Embarking on familiarization tours, Dr. Bampoe engaged with various NHIA directorates and some district officers to understand operational frameworks and share his vision for the authority's future.
We want to follow the President's vision about Mahama Cares, free primary health care, because we want to achieve universal health coverage. So that is the President's vision, and we at NHIA, under my leadership and with your support, will make sure that the President's vision is actualized and realized.
When His Excellency the President was campaigning to come into office, he promised that something that the previous government had done, which was to cap the levy, he said he was going to remove the levy, and he has done that, which means that all the funding that is coming nominally to the health insurance fund is actually released to the fund. Previously, what was happening was that some of it was being taken away. So that's an important thing that the President has done.
Addressing financial challenges, the NHIA under Dr. Bampoe's leadership cleared outstanding vetted claims amounting to 834 million Ghana cedis to healthcare providers nationwide, reinforcing the authority's commitment to timely service delivery.
The truth of the matter is that for this year, we've paid claims of up to 834 million cedis. And over the past week, we paid, I think, 555 million cedis. So all the vetted claims that we have in the system, we've paid.
To restore public confidence in the National Health Insurance Scheme, the NHIA initiated efforts to tackle illegal charges in health facilities and directed more funds towards claims payments.
We want to make sure that as NHIA, we are doing exactly what we were set up to do, and that is to pay claims. So we want to ensure that in year one of my tenure here, at the very least 65% of the funding that is given to us goes to pay claims. And by year two, we want to move it up to 70%.
Strengthening partnerships was pivotal. In February, the Private Health Facilities Association of Ghana and several stakeholders paid a courtesy call on Dr. Bampoe, aiming to bolster collaboration and ensure quality healthcare delivery. Beyond operational reforms, Dr. Bampoe has prioritized staff welfare, launching initiatives like the establishment of the NHIA Staff Credit Union to enhance financial security and staff well-being.
They're bringing up a lot of ideas. We're setting up this credit union, which means that after you've contributed for 6 months, you can go borrow money to buy a plot of land, to buy a car. We're setting up something, also looking at how they can give us preferential rates and some kind of scheme so we can get cars and so on.
Recognizing the importance of broad partnerships, Dr. Bampoe's leadership has reached across sectors, engaging key stakeholders to co-create solutions for healthcare delivery challenges.
Later on today, we are actually inaugurated a committee of senior level directors that I've put together to look at what we call co-payments, but actually illegal out-of-pocket payments, which if the NHI is working properly should not exist.
This task force is dedicated to investigating and eliminating unauthorized charges imposed on NHIS cardholders at healthcare facilities. With a focus on efficiency, the NHIA under Dr. Bampoe is leveraging technology, upgrading claims payments, enhancing data transparency, and improving provider payments.
What the organization has done is to use innovation to try and to increase the scope. And apart from the concerted drive to get people on the scheme, there's also using digital tools to make sure that people are registering. So for people in the formal sector, for example, now you don't have to go to a booth or go to see somebody to get your subscription renewed. It's done automatically. Even for those who pay, there's a subscription-based way by which you can auto-renew digitally, so you don't have to interface with somebody. And on the supply side, we have over 5,000 providers. And until recently, claims were being processed manually. But we have over 99% of our claims now being processed digitally, which means that we can do it in a quicker way and providers can get paid, through quicker means. And this makes the system work even better.
At his press briefing in April 2025, Dr. Bampoe unveiled a bold 3-point vision to revitalize the NHIS. 1. Enhancing internal controls for efficiency and promoting staff welfare.
And there are 3 things that we want to do. Number 1 is actually to make sure that we tighten the financial loopholes to make sure that all the funding that is being given to service providers actually goes to pay for work that has already been done. Also, we know that once we are working with people, we need to make sure that we give them the tools to work properly, to be okay to deliver upon their work. So the first bit is focused internally on the National Health Insurance Authority everywhere within the country.
2. Restoring public trust and confidence by reducing out-of-pocket payments.
The second is the customer experience. We know that illegal payments is such a big problem, out-of-pocket payments. We want to make sure that we stamp that out so that we restore confidence in the fund. Make sure that when people go to hospital, they don't have these unpleasant experiences. We're looking at people who use the scheme to make sure that they have the best experience.
3. Delivering on Mahama Cares and free primary health care.
The third is what we spoke about earlier, making sure that we play our part when it comes to Mahama Cares and the free primary health care. So those are the 3 pillars very broadly upon which I think that our new executive management will be looking to strengthen so that we have a better national health insurance authority.
Supporting Dr. Bampoe in realizing the President's vision are 3 dedicated Deputy Chief Executives. Dr. Senano Kwesi Jokoto, Deputy Chief Executive in charge of operations.
Working as the Deputy Chief Executive Officer in charge of operations for the NHIA, I've also seen a lot of groundbreaking intervention over the past 120 days. The most significant would be the uncapping of the National Health Insurance Levy, which makes more money available for the delivery of quality health care services. As a result, the scheme under the leadership of Dr. Bampoe has been able to make payments to all healthcare facilities that have rendered quality services to its members. This amounts to close to 1 billion. We are aware that human resource is key. As a result, at the Operations Division, we have worked to build the capacity of so many staff so that our operations will be enhanced, even as we interface with healthcare providers and the people of this country.
Ms. Anatu Ann Seidu Bokobiri, Esquire, Deputy Chief Executive overseeing finance and investments.
Claims payment is the bedrock of national health insurance per Section 41 and 2 of the National Health Insurance Act 2012, Act 852. So I've supervised the payment of arrears of claims for up to February of 2025, and health providers are happy. As you know, they are main stakeholders with Dr. Bampoe's team, including myself. We are aiming at 0 arrears of claims. This is the target. 0 arrears of claims, and whereby we would ensure that claims are paid within at least 3 months of processes.
Mr. Raphael Yelfoglo Sekep, Deputy Chief Executive, responsible for administration and human resources.
Myself and my team in Admin HR division are basically looking at plugging in to the larger vision of the CEO, which he has articulated to include system strengthening, which is very critical to whatever success we can achieve as an institution. And by system strengthening, from the HR perspective, we're looking at putting in policies and systems, procedures that will help motivate our staff as our number 1 human resource of the organization, because there is such a groundswell of discontent among staff with regards to promotions and being stagnated and having been here for years, and others have come and gone ahead of them, and people are very dissatisfied. So we are really in a hurry to have this resolved so that people can feel that they belong. People can have that corporate citizenship that we crave and have that level of engagement that we desire, so as to enable us achieve His Excellency's vision and to help achieve tackle co-payment. And so that for me is key.
Dr. Victor Asare Bampoe's first 120 days at the NHIA mark a renewed commitment to universal health coverage, transparency, and stakeholder engagement. His leadership, together with his capable deputies, continues to shape a more resilient and accessible health insurance system for all.